Hello everyone, this is our presentation over Wilms Tumor. This is brought to you by Mignon, Destiny, Brasia, myself Leanna, Jasmine, and Ronica. So what is Wilms Tumor? Wilms Tumor is also called nephroblastoma. It is a cancerous tumor that originates in the cells of the kidney. It is the most common type of renal cancer and accounts for about 6% of all childhood cancers. Approximately 400 children in the U.S. are diagnosed with the Wilms tumor each year. With that said, it is an extremely rare kidney cancer that is highly treatable. The kids who are actually diagnosed with this disease go on to live a normal, healthy life. This disease can occur at any age between infancy and 15 years old, but in most cases, the tumor is detected by the age of 3. This cancer affects both males and females equally. The tumor can be very large and also spread to other body tissues. The most common site for the Wilms tumor to spread to is in the lungs. Lesions may also occur, however, it also can affect the liver, other kidney, brain, and bones. Most often, this is developed in one kidney and spreads to the other in about approximately 5 to 10% of children. So, what causes Wilms tumor? Most cases of Wilms tumor are considered sporadic, which is, occurs by chance, and are the result of genetic mutations that affect cell growth in the kidney. It is uncommon for Wilms tumor to run in families. Less than 2% of cases will have an affected relative. These mutations generally arise after birth, but in some cases, children are born with a genetic alteration that predisposes them to cancer, unfortunately. So here on this slide, there are some signs and symptoms that are listed. The following are the most common symptoms of Wilms tumor. However, each child may experience symptoms differently. Symptoms may include a non-tender mass or lump that is felt or seen in the abdomen, swelling in the abdomen, veins that distend or are large across the abdomen, blood in the urine, pain in the abdomen from pressure on the other organs near the tumor, a decreased appetite, weakness, tiredness, fever, high blood pressure. If the tumor is suspected in a child's abdomen, it is extremely important for you not to apply pressure to this area. You have to take caution, bathing and handling the child. This is necessary before and during any tumor eval. And the reason is because rupture of the tumor may lead to cancer cells spreading to the other tissues in the body. And the symptoms of Wilms tumor may resemble other medical conditions or serious illnesses, which is why it's always, always, always important for you to consult your child's physician for an accurate diagnosis. So, Wilms tumor is diagnosed in several ways. In addition to a complete medical history and physical examination by the child's physician, some diagnostic procedures that may be included in the patient's diagnosis is an abdominal ultrasound, which can provide an outline of the kidneys, the tumor, and determine if there are any problems in the renal and other major veins in the abdomen. It can also determine if there are any lesions or tumors in the opposite kidney. A CT scan is actually used to show detailed images of any part of the body, including the bones, muscles, fats, organs. A CT scan is way more detailed than an x ray. Although we they do perform a chest x-ray, which can determine if there is any spreading of the cancer cells into the lungs. An MRI is another test that's performed, and an MRI can actually determine if there is any spreading of the tumor cells into the lymph nodes and other organs that could be involved. Wilms tumors can compress other organs in the area, causing effects to their function. Blood and urine tests are used to evaluate the kidney and liver function. A biopsy is performed, and parts of the tissues are removed and examined under a microscope. And this determines the extent of the disease and confirms the diagnosis. Surgical removal of the tumor and kidney. Surgery may be necessary for a definitive diagnosis and determining the extent of the disease. Again, these are just some diagnostic tests that are used, not all. So, good nutrition is very important for the children who are being treated for the Wilms tumor and ultimately any cancer. The children with the Wilms tumor often have poor appetites due to one or more of the following, which is the hospital environment, the side effects from the chemotherapy or radiation, depression, changes in the cells of the mouth, which will alter the way that the food actually tastes, side effects for medications, inadequate absorption of calories, vomiting, and diarrhea. Poor nutrition contributes to poor growth. If a child with Wilms tumor maintains adequate nutrition, then the child may be more likely to better tolerate chemotherapy, radiation, with fewer side effects, heal, grow, develop, and ultimately maximize the quality of life. Children with the cancer often have increased calorie and protein needs. So protein is needed for the growth and help the body repairs itself. Getting enough calories can help the body grow and also prevent weight loss. If your child is having trouble eating enough calories and protein, the child's physician or dietitian may suggest serving a high calorie, high protein food, which incorporates like eggs, milk, peanut butter, cheese. But sometimes, unfortunately, even when you have a high calorie and high protein diet being offered, children still have trouble eating enough and getting enough nutrients, which then leads to possible tube feedings, which is, an NG tube that is put through the nose, down the esophagus, and into the stomach. A high calorie formula or supplement can be given to your child through this tube to help promote appropriate growth and development. Children undergoing the treatment for cancer sometimes need TPN, which is, the total parental nutrition. And this is simply to help meet the nutritional needs. TPN is a special mixture of glucose, protein, fat, vitamins, and minerals that is given through an IV, which is straight into the veins. TPN provides the nutrients, again, that your child needs when the child cannot eat or absorb the nutrients from other foods. The TPN is a solution that is usually infused continuously over several hours of the day, but it is extremely important that you keep in mind that this is something that cannot just be stopped abruptly, as this may cause the blood sugars to drop significantly. Here are some tips just to improve your child's meal time. If you're having any problems, you can try smaller, for more frequent meals and snacks. Try changing the time, place, and surrounding of the meals. Like put them in a good, happy environment, park, somewhere they like to go, maybe the mall that has some activity. Let your child actually help and prepare the meals that you're preparing for dinner. Getting the child involved gets them excited and more likely to eat because they know that they made it. Offer high calorie, high protein meals and snacks. Of course, you can get recommendations from your physician or dietitian. Avoid forcing your child to eat. This may actually make your child not want to eat even more and may make their appetite worse. Make mealtime happy for them. Get your family involved. Have them watch, TV or have their iPad, around them so that they can go ahead and watch TV but enjoy eating. Anything to get these kiddos to eat. Again, nutrition is very important for them.
Hi, my name is Jasmine. I'm going to be talking about nursing processes for this disease. Um, One of the main important things that we want to do is hand hygiene. This is extremely important to consider due to them having a compromised immune system. This causes them to be more susceptible to infection. We also want to assess for bleeding. As you guys know, we don't want our patients becoming hypovolemic. This causes kids to become short of breath, tachycardic, and also it affects the quality or quantity for circulating platelets, which is why we want to monitor labs that include the white blood cell count, the platelet count, the hematocrit count, and the neutrophil count. When these labs are low, they're at risk for infection, prolonged bleeding, and immune thrombocytopenic purpura. ITP is when the body attacks platelets needed to prevent excessive bleeding. We also want to avoid firm and hard toothbrushes because this increases the risk for bleeding. It is very important to make sure that our children use a soft, age-appropriate toothbrush. Whenever the child has an IV or gets a shot, we want to apply pressure for 5 minutes because this will allow the clotting time and it'll prevent excessive bleeding. We also want to assess for fever, which indicates an infection. This helps protect the children from any illnesses or infection. We also want to prevent anxiety and keep the child comfortable. We want to make sure the child knows everything that we're doing, and if possible, we want to ask the parents to help with doing this because nothing is worse than having a child that's not comfortable. One of the main things that we also want to focus on is not palpating the abdomen. Palpating something that is swollen or anything like that is very dangerous. This can cause the tumor to rupture and spread the cancer cells. Another important thing is we want to make sure that our child does not play any contact sports. It is very, very discouraged because it can cause rupture of the kidney or the tumor or anything else that is
Get ready for question time.